Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. Happy Thanksgiving Eve. We're going to jump right to it with Dr. Michael Fine, former Rhode Island Director of Health and now the advisor to the task force organized by the House of Representatives to look at the vaccine distribution in Rhode Island. Dr. Fine, thanks so much for joining us.
It's very nice to be with you, Josh.
Okay, numbers are out again. You know, let's start with the testing. The testing again seems to be struggling. 5,079 college tests overall across the whole state. 14,978, so less than 10,000 tests at what you would think would be the absolute busiest time for demand for testing, and I believe that is true. You've got folks trying to get tested before vacations, family gatherings, etc. You've got more spread than at any other time in the history of the virus, and we can't seem to get out of our way on the testing.
Well, the good news is there's a new testing site in Central Falls that's testing about another 150 people a day. And I think there's a couple of other new testing sites around. We're not seeing their numbers show up in this. The Central Falls site uses the Binax Now test, which is an antigen test that is probably the least sensitive of what we've got out there. And it's not being backed up by PCR. So that testing is going to miss some people. And I don't know whether it's being integrated into the state's total numbers yet. I think that went up very fast. So I think we'll have to wait and see till next week and see what the catch-up numbers tell us. Again, I'm betting that by next week we're looking at 2,000 positives every single day, and deaths looking more like 20 a day than 10 a day, unfortunately.
So let's go through all the numbers. 845 new cases, but as I said, just on about 10,000 tests conducted yesterday. So if you double that to the 20,000, you're looking at 1,700 new cases on a daily basis, kind of similar to yesterday. Hospitalizations jumped yet again. We were at 323 yesterday. We're now up to 357. We're heading right towards, I believe, the all-time high. And actually, if you really think about it, because previously patients usually stayed in the hospital for as much as 10, 12, and longer in ICU and on ventilators, they're less likely to be on ventilators and in the ICU. They're out in a shorter period of time. That 357 number is got to be concerning for everybody in the healthcare primary forefront of first responders. That number is just getting away from us.
Yeah, and I expect it to double and triple before we're done. Remember, in the hard parts of May, the number of cases started to come down. Our number of cases continued to increase. So, and remember, there's a 2 to 3 week lag between the number of cases increasing and the hospitalizations increasing. So expect more people in the hospital. I mean, just expect, I think we got to expect, 800 to 1,000 by the middle of December, dwarfing what we had before. The ICU numbers going up, I don't love either, even though the total number is less than it was.
Dr. Fine, 10 more deaths. Yesterday was 16. I think it was, not counting today, it was 47 in a 7-day period. Takes us up to, the numbers just keep going and going.
Yeah. No, I think we got to get ourselves mentally ready for 100 to 150 deaths a week. And that's going to be a heartbreak. I mean, I think we have to be ready for some tough times over the next 6 to 8 weeks.
Dr. Fine, I don't know if you saw it, if those out there haven't seen a 60-minute segment on the long haul, those who are suffering long-term health impacts, young people in their 20s, 30s, and 40s, active marathon runners who are very significantly sick months after having the coronavirus. One woman who is a marathon runner, at 6 months later, she can barely walk a block or two. the implications of these long-term health effects have very significant. Listen, you may not die from this thing because you go to grandma's tomorrow, but you may be in terrible health for months or years.
Yeah, one of the things that I'm seeing that's interesting and unfortunate about these reports is that this kind of long-term effect appears to be happening not in so much in people who have severe illness when they get infected, but people with mild illness or even trivial illness seem to be being encountering these long-term effects. We're going to have to wait for 3 to 5 years before we shake out how common these are, how serious they are, and so forth. And to be told, to be clear, sorry, every significant epidemic or pandemic carries with it the risk of this kind of thing, this post-infectious autoimmune phenomena we see with a fair frequency. The real difficulty about this one is because every single person is going to need either going to get infected or get the vaccine. The population base that can get into trouble is way larger than anything we've seen in many years.
Yeah, Dr. Fine, it's just, the implications of what the longer term effects, lots of folks celebrated the stock market going over 30,000, which is good news for those who are in the stock market. But the economic carnage is really starting to roll out, especially in places in Rhode Island. I mean, you're just seeing the small business after small business closing. We've got a huge issue related to eviction. Some companies that own significant amount of rental properties, but lots of rental properties in Rhode Island are, families that are in 3-deckers or two-family houses, that other rent is helping pay the mortgage and support their family. They can't go for 3 and 6 and 12 months without rental income coming in, without their own economic devastation. The implications are just beginning to be felt as to how this disease affects American families, Rhode Island families.
Yeah. And that's where, we've got to do everything we can, as far as I can see, to control the community spread of this disease. That, which we really haven't accomplished. Now, I think there's some hope with the vaccine, but again, we've got 6 to 8 months of this, and we got to be mentally prepared for that and be ready to help one another through this next 6 or 8 months. The good news, it's not forever, but the bad news is it isn't going away on December 20th when the vaccine gets released for the first time in Rhode Island or thereabouts. It's going to take us a good 6 to 8 months to get people vaccinated and make sure people want to get vaccinated. One of the other things that I'm worried about in Central Falls, we are hearing again and again from people on the street in Central Falls that they don't trust the vaccine, that they don't trust the government, that they're going to wait until lots of people have been vaccinated before they get vaccinated. And that puts communities at greatest risk, at even greater risk for a longer period, unfortunately.
Yeah, this is going to be a hard one. I mean, you're hearing it from healthcare professionals in surveys, both regionally and across the country, that they are a significant portion, more than a majority, of frontline healthcare workers, nurses and doctors, are saying, we're going to wait and see, or we're not going to take a vaccine. And part of that is a little bit of the broken trust that we're suffering from, both with the pharmaceutical industry and with government. And also there's just this sense of this incredible pressure to race forward with a solution, and hopefully it's done as thoughtfully and the time is taken to make sure that it is as analyzed as possible to ensure that there's public confidence in it.
Yeah, and I hope that there is. I think this is going to be a fits and starts process. We're all excited about the arrival of vaccine, but nobody should be disappointed if the vaccine or one of the vaccines proves to have some difficulties as we expand the number of people who get vaccinated. Remember, we're testing, the phase 3 trials are in the 40 to 50,000 range number of people. When we start immunizing, 100,000, 500,000, and then millions, we'll start to see some side effects that we didn't know about. And that's part of the normal process, but I fear that people will get freaked out by it. And that's why I'm talking about it now, so people aren't freaked out about it when we get there, and we just need to understand that this isn't going to be perfect, and we're going to learn as we go and do the best we can to keep everybody safe.
Dr. Fine, the governor goes on in 7-8 minutes. I don't expect major announcements from the governor. I think she's going to be announcing a couple of economic support initiatives, one for small businesses in Rhode Island, urging folks to shop local. We like people to shop local, support local media. We're capitalists. We want everybody healthy. We want all the businesses open. And secondly, understanding that there may be some relief coming for the wedding and entertainment industry that has been so hard hit, as we heard yesterday in an interview. Do you have any thoughts of what the message needs to be? We go into Thanksgiving and then we go right into, quote, the pause, which is a partial shutdown of certain industries in Rhode Island?
Yeah, I think the short-term message is important, and it is really stay home tomorrow. Stay with your household. Don't bring households together. There will be another Thanksgiving that will be more fun than this one, but go to Zoom, do everything you can not to spread the disease around by being with other people. And then my hope is, I doubt the governor will say this, but I hope people stay home on Friday too, because I'm just as worried about Friday as I am about tomorrow. I don't think we ought to be seeing lines of people in front of big box stores. And maybe this is our materialism come home to roost. But this is a time to sort of think about Thanksgiving and think about people, not think about stuff.
Yeah, Dr. Fine, I think you hit it right on. To paraphrase an ad campaign that the Department of Health in Minnesota has initiated is, grandma's pumpkin pie is not worth dying for. I think it's a realization tomorrow about what our values are and how important it is to stay home and stay isolated. Call, Zoom, send a letter, order flowers, whatever you need to do. But it is critical to the future of Rhode Island's economy and public health that folks stay home tomorrow. There's no two ways about it. Every day we come on here and talk about the math, and we predict what's going to happen in the next 2 to 3, 4 weeks. It's not we have a magic ball, it's just simply math. It's all numbers. And you can see a devastating outcome already coming in December and January. Thanksgiving implications could drive that to a whole new level. So I really encourage folks, we're locking down. I know it's not easy. It's a favorite holiday. It's my favorite holiday, but really encourage people. I know you've scheduled it. You're planning on going. Make the decision. Reverse the order. Order Chinese food, whatever you have to do to have a day at home that's safe. You won't regret it for the rest of your life by staying home for Thanksgiving. You could regret it for the rest of your life if you go to Thanksgiving. Everybody, please stay safe. Wear that mask, save a job, save a business. Stay tuned for 1 o'clock with Governor Raimondo. Everybody be home, enjoy Thanksgiving, think about what's so special to you, and please stay safe over the next few days. Thanks, everyone.
Thanks, Josh.